Hi everyone, my name is Dalley, and today we're going to be talking about the medial compartment of the thigh. We first start by the muscles of the medial compartment, which are actually split into superficial and deep muscles. The first of the superficial muscles is the pectineus. It originates from the pectineal line of the pubis and inserts onto the pectineal line of the femur, and is the only adductor that is innervated by the femoral nerve. The second muscle is the adductor longus. It originates from the body of the pubis and inserts onto the medial lip of the linea aspera, and is innervated by the anterior branch of the obturator nerve. The adductor longus is commonly injured in horseback riders, and what's described as rider's strain. A brevet strain could eventually lead to the ossification of the tendon in what's described as rider's bone. The third muscle is the adductor brevis, and it's located behind the adductor longus. It originates from the body and the inferior ramus of the pubis and inserts onto the upper medial lip of the linea aspera, and is innervated by the anterior branch of the obturator nerve. Note that the adductor brevis is an important anatomical landmark as it lies in between the anterior and the posterior branches of the obturator nerve. The fourth and last superficial adductor muscle is the gracilis. It originates from behind the adductor brevis, namely the body and the inferior ramus of the pubis, and inserts onto the superior medial surface of the tibia, and is innervated by the obturator nerve. Note that the gracilis is the only adductor muscle that passes through the hip and the knee joint. However, it's small and has no important role in initiating movement. Therefore, in ACL injuries, tendons of the gracilis and the semitendinosus are harvested, are sutured together, and are used as a graft to replace the torn ACL. Now let's move on to the deep adductor muscles. First deep adductor muscle is the obturator externus, which originates from the ischial and pubic margins of the obturator foramen and inserts onto the trochanteric fossa, and it's innervated by the posterior branch of the obturator nerve. Last and the most powerful adductor muscle is the adductor magnus, and it actually has two parts. The adductor part originates from the inferior ramus of the pubis and the ischial ramus, whereas the hamstring part originates from the ischial tuberosity. In terms of their insertion, the adductor part inserts onto the medial lip of the linea aspera, whereas the hamstring part inserts into the adductor tubercle of the femur. In terms of their innervation, the adductor part is innervated by the obturator nerve, whereas the hamstring part is innervated by the tibial branch of the sciatic nerve. Note that the two parts of the adductor magnus are separated by the adductor hiatus. Also, on the lateral end of the adductor magnus, there are foramina through which the perforating arteries pass through. In terms of the actions of these muscles, the hip adduction is contributed to by the pectineus, adductor longus, adductor brevis, gracilis, and adductor magnus, whereas hip flexion is contributed to by the pectineus, adductor longus, adductor brevis, and adductor magnus, and slightly assisted too by the gracilis, whereas hip extension is only performed by the hamstring part of the adductor magnus. In terms of rotation, hip lateral rotation is performed mainly by the obturator externus, whose major role is to hold the head of the femur tight inside the acetabulum, whereas medial rotation is actually performed by the gluteus minimus and medius. However, it's assisted by the pectineus, adductor longus, and adductor brevis. As the gracilis crosses the knee, it contributes to knee flexion and knee medial rotation. Let's move on to the femoral triangle. The femoral triangle is an important anatomical space on the anterior medial surface of the thigh. In terms of its boundaries, the base is the inguinal ligament, which spans from the ACIS to the pubic tubercle. However, the medial border is the medial margin of the adductor longus, and the lateral border is the medial margin of the sartorius. Deep to the inguinal ligament is the retroinguinal space, which acts as a passageway for neurovascular structures from the abdominal pelvic cavity to the femoral triangle, and it's actually divided into two compartments: a muscular compartment formed mainly by the iliopsoas muscle and the femoral nerve, and the vascular compartment through which the vessels pass through, which changed their name from external iliac to the femoral as they crossed into the femoral triangle. In terms of the contents of the femoral triangle, laterally to medially we have the femoral nerve, femoral artery, femoral vein, and the femoral canal, which has within it the deep inguinal lymphatic nodes and the associated lymphatic vessels. Proximally to the femoral triangle there is a femoral sheath, which is divided by vertical septa into three compartments: lateral compartment, which contains the femoral artery, intermediate compartment, which contains the femoral vein, and the proximal compartment, which contains the femoral canal. Note that within each of these compartments there is enough extra space to allow for the vessels to glide within the compartment. Also, it allows for the distension of the veins. The opening of the femoral canal is a very weak spot within the abdomen and can result in the intestines passing through the canal, forming a femoral hernia. The excavator of the femoral artery, it can be used for several purposes, such as palpating the femoral pulse, blocking blood circulation in the case of trauma, and also it can be cannulated for cardiac angiography. The last thing that we'll be talking about is the adductor canal. The adductor canal starts from the apex of the femoral triangle and descends medially along the thigh and posteriorly through the adductor hiatus. The adductor canal is bound posteriorly by the adductor longus and adductor magnus, and anterior laterally by the vastus medialis, and medially by the sartorius. The neurovascular structures that travel through the adductor canal are the femoral artery and femoral vein, which become the popliteal vessels as they exit the adductor hiatus. And last but not least, we have the nerve to the vastus medialis and the saphenous nerve. Note that local anesthetics can be applied to the adductor canal, blocking the nerve to the vastus medialis or the saphenous nerve, which is described as the adductor canal block. Thank you so much for making it this far through the video. I hope you find it interesting. Take care. Bye bye.